Good evening, everybody. I just want to do a quick announcement before we begin. We do have a live transcription going on for tonight for anybody that is hard of hearing. It's down at the bottom of the screen. If you'd like to remove it, where it says live transcript on your screen, if you click the little up arrow, you can hide subtitles if you'd rather not see it. The other thing I'd like to mention is that we do have Spanish and Portuguese interpretation this evening. If you click the button on the bottom of your screen that says interpretation, you can choose either Portuguese or Spanish. And with that being said, I'd like to turn it over to Cheryl Osmo.
Thank you very much, Sarah Beal. We appreciate your help this evening. Good evening. I'd like to thank everyone for joining us this evening for this virtual community event to learn more about the Massachusetts PFAS and Your Health study, a new federally funded study on Cape Cod aimed at understanding the health impacts from past exposure to PFAS in drinking water. My name is Cheryl Osmo. I'm the Executive Director of the Massachusetts Breast Cancer Coalition and a community partner on the Massachusetts PFAS and Your Health study. I'm also the Cape Outreach Coordinator for Silent Spring Institute. The Massachusetts PFAS and Your Health study is a 5-year effort led by Silent Spring Institute in collaboration with Harvard T.H. Chan School of Public Health and Eastern Research Group. The study is focusing on 2 communities in eastern Massachusetts, Hyannis and Air, where public drinking water supplies have been contaminated by PFAS from use of firefighting foams at nearby fire training areas. It is one of the 7 projects funded by the U.S. Centers for Disease Control and Prevention, CDC, and the Agency for Toxic Substances and Disease Registry, ATSDR, as part of the ATSDR multi-site health study on PFAS. Community partners include Massachusetts Breast Cancer Coalition and people of Air concerned about the environment. On behalf of the health study team, I'd like to welcome you here this evening for this informative discussion to learn about the project's goals and to find out who is eligible to sign up. We're joined today by Dr. Laurel Shader, Senior Scientist from Silent Spring Institute and Project Lead for this health study, and Barnstable Town Manager Mark Els. And now I have the pleasure of introducing Mark, who has worked for the town of Barnstable for 31 years. He has also been an adjunct professor, faculty member at Cape Cod Community College for 19 years in their business administration program. Mark serves on several regional and statewide committees ranging from environmental, human services, education, and transportation issues. I want to thank you, Mark, for your support of the Massachusetts PFAS and Your Health study, and for the long-time support from the town of Barnstable, which has paved the way for us to be doing this work today. We're so pleased to have Mark join us, and I'll now invite him to say a few words.
Thank you, Cheryl, and good evening and welcome, everyone. I want to thank you for joining us for a virtual community kickoff for the study, Massachusetts PFAS and Your Health. On behalf of the town of Barnstable, we welcome you and encourage you to listen, learn, and participate. It's no coincidence that Barnstable has partners that are here with us tonight and work so closely with Silent Spring Institute on these very important issues. Our shared core values that everyone should live in an environment that's safe and free from pollutants of concern is at the foundation of our relationship. Research, such as the study being discussed this evening, is critical to our efforts to better understand how these contaminants impact us and to better manage these issues moving forward. For those of you who are familiar with Barnstable, it's our mission to maintain a high quality of life for our residents and visitors, and our water resources are a critical part of that quality of life. I will note that though our drinking water in Hyannis is now free of PFAS contamination resulting from prompt action by our community to correct this issue and to ensure safe drinking water, the concerns regarding these emerging contaminants is ever present. It's there in the products we use every day, and we need your assistance to stop the use of these products, to understand this so that we can move forward in keeping a safe environment. I thank you, I welcome you, and I'll turn it back over to Cheryl now. Thank you.
Thank you very much, Mark. We appreciate all that you do and have been doing for so long. I'm now very proud to introduce the project lead, Dr. Laurel Shader, senior scientist from Silent Spring Institute. Dr. Shader leads the Institute's water quality research on PFAS and other contaminants of emerging concern. She studies PFAS chemicals in drinking water, consumer products, and food, drinking water contaminations from septic systems, and environmental justice disparities in drinking water quality. She is a nationally recognized expert in her field and is currently working on 2 other national health projects funded by the National Institute for Environmental Health Sciences. We encourage you to use the Q&A feature in Zoom to submit your questions throughout this program. We will do our best to respond to all of your questions this evening. Thank you, and I'll now turn this over to Dr. Laurel Shader.
Hi, good evening, everyone. Thank you very much for that introduction, Cheryl. I'm going to share my slides here. Hang on one second. Okay. And then one more second here. Great. So good evening, and thank you for coming to tonight's event. My name is Laurel Shader. I'm a senior scientist at Silent Spring Institute. Silent Spring is an independent scientific research organization. We have conducted public health research on Cape Cod since the mid-1990s. We were founded by visionary activists at the Massachusetts Breast Cancer Coalition in response to concerns about elevated breast cancer rates on the Cape and the need for more research on environmental causes of disease. We have conducted extensive studies on new and emerging contaminants in the waters of Cape Cod. As Cheryl said, I'm the lead investigator for the Massachusetts PFAS in Your Health study, and I'm delighted to be here tonight to share with you information about this study and to answer any questions that you may have. So we're going to start out tonight's presentation with an overview of what are PFAS and about the new study. After that, we will have short introductions by some of the other members of our research team. To do a research study like this really takes a lot of different people, and I'm really glad for all the partners that we're working with as part of this important endeavor. Then we will have a question and answer session where there will be the opportunity to ask questions. We'll stay on until everyone's questions are answered, even if that runs past 7:30, because we're glad you're all here and we want to make sure that we are addressing everyone's questions and concerns. So first off, for my presentation, I'll share information about what are PFAS and why are they of concern. I'll talk broadly about PFAS in drinking water, both at a national level and locally in Hyannis. Then I'll provide an overview of the Massachusetts PFAS and Your Health study. This is being led by Silent Spring Institute and is part of the multi-site health study. This is a larger study that's being funded and coordinated by the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry. I'll describe the parts of the study and what participants will be asked to do and what they'll receive. Then I'll end with ways that you can learn more and contact our study team. So what are PFAS? PFAS stands for per and polyfluoroalkyl substances, kind of a mouthful. According to the EPA, there are over 9,000 different compounds that are classified as PFAS. These do not occur in nature, and all of them are manufactured by industry. PFAS chemicals are characterized by having many carbon-fluorine bonds, which are some of the strongest bonds in chemistry. These bonds make PFAS extremely resistant to degradation, meaning that all or parts of their chemical structures don't break down. They're also mobile in the environment and have been found as far away as in the Arctic. PFAS have been used in consumer products since the 1950s, but it's just been in the past 5 or 10 years when they've really started to attract so much attention and concern. This is due in large part to their discovery in drinking water supplies all across the US. I won't get into the chemistry of PFAS tonight, but I wanted to show you an example of a PFAS chemical. Here on the right is a chemical called PFOA. Sometimes it's called C8 because it has an 8-carbon chain backbone in the middle of its chemical structure. This was the chemical that was featured in the film Dark Waters. with Mark Ruffalo and Anne Hathaway. And if you haven't seen that film, I would recommend that you watch it. The film depicts a community in West Virginia that was affected by PFOA contamination and the heroic efforts of a lawyer, Rob Bilott, on behalf of the community. While PFAS is not really a familiar household name, products containing PFAS are all around us. Some have familiar trademarks, such as Stainmaster or Scotch Guard treated carpets, Vortex jackets, and Teflon pans. But PFAS can also be used in products where we really don't have a clue about whether or not they contain PFAS, such as microwave popcorn bags, fast food wrappers, and even dental floss. PFAS are also used in a common class of firefighting foams called AFFF, and I'll talk more about those a little bit later. So all of us, regardless of where we live, are exposed to PFAS. Testing by the CDC has found that over 99% of Americans have PFAS in our blood. This is not surprising since PFAS are used so widely in many products. They are extremely persistent in the environment, and they have the tendency to accumulate in the body. Human exposure to PFAS is a public health concern that has generated increasing concern in recent years. Although there are over 9,000 different PFAS compounds, only a few have been studied extensively to understand their health effects. These include PFOA and several related PFAS chemicals that are no longer manufactured in the US, but are still present widely in the environment. Scientists can learn about the toxicity of chemicals like PFAS through studies of laboratory animals, which are called toxicological studies. They can also learn about harmful health effects through studying populations of people who've been exposed in epidemiological studies. And there are newer lab-based tests called in vitro studies that can also provide some insight into how chemicals can be toxic. Based on these types of studies, exposures to PFAS chemicals have been associated with a range of health effects. These include kidney and testicular cancer, thyroid disruption, elevated cholesterol, decreased birth weight, developmental effects, changes in liver enzymes, ulcerative colitis, preeclampsia, which is high blood pressure among pregnant women, and immunotoxicity, including reduced antibody response, particularly in children. Other PFAS chemicals, especially newer versions that are now being used to replace PFOA and other compounds that are no longer manufactured in the US, have not been studied as much, although there is growing evidence that they raise some of the same health concerns. PFAS have been found in drinking water supplies all across the US. The Environmental Working Group has estimated that over 200 million Americans have some level of PFAS in their drinking water. The Environmental Working Group has tracked over 2,000 sites across the US where PFAS have been found in the environment or in drinking water. This is a map that shows the compilation of information collected by the Environmental Working Group. You'll notice that some states like North Carolina, New Jersey, New Hampshire, and Michigan have a lot of dots. And the reason for this is due in large part to the fact that these states and others have conducted more extensive testing to see whether PFAS are in drinking water and in the environment. Although PFAS are present in many drinking water supplies, and there are many concerns about health effects related to exposure, there are currently no federal drinking water standards for PFAS. This means that under federal rules, public water supplies don't have to test for PFAS, and they don't necessarily have to take action if the levels are high. In 2016, the Environmental Protection Agency did issue a non-enforceable lifetime health advisory for the total amount of 2 specific PFAS chemicals, PFOA, which I already showed you, and a related compound, PFOS. They set this guideline level at 70 parts per trillion, which is equivalent to 70 nanograms per liter. This was quite a bit stricter than their previous guideline, which had been set at 200 parts per trillion just for PFAS and 400 parts per trillion for PFOA. Many scientists and regulators think that that guideline is not adequately protective. And 12 states have set stricter guidelines than the EPA guideline. Massachusetts is one of these states. In 2020, the Massachusetts Department of Environmental Protection established an enforceable standard of 20 parts per trillion for the total amount of 6 PFAS chemicals. So this is stricter than the EPA guideline in several ways. For one thing, it's an enforceable standard. So under this new maximum contaminant level, public water supplies in Massachusetts do have to test for PFAS, and they're required to take steps to meet this new standard. A second thing is that the level is set much lower, so 20 parts per trillion instead of 70. And the third thing is that it refers to the total amount of 6 PFAS chemicals, so PFAS, PFOA, and 4 other related chemicals. So how do PFAS get into drinking water in the first place? One common source of drinking water contamination is a class of firefighting foams called AFFF, or aqueous film forming foam. These are commonly used at military bases, major airports, and other fire training areas. They're used to fight and train for fuel fires, for instance, if a plane crashes. On Cape Cod, PFAS have been found in groundwater and soil at the Barnstable County Fire Training Academy and at the Barnstable Municipal Airport in Hyannis. PFAS have also been found at Joint Base Cape Cod and those PFAS have reached the drinking water wells for the Mashpee Public Water Supply. However, Joint Base Cape Cod is too far away to affect the drinking water in Hyannis. And even though we often talk about one sole source aquifer on Cape Cod, there are separate sections of the aquifer that are not connected to each other. In other parts of the country, high levels of contamination have been found near industries that produce PFAS or use them in products. However, this is not a likely source on Cape Cod because there are no kinds of industries like this on the Cape. Lower levels of contamination can come from other types of sources associated with wastes. So for instance, sewage treatment plants and septic systems can contain PFAS because of the use of PFAS-containing products in homes and businesses. Landfills can also be a source because the water that percolates through the waste in landfills can pick up PFAS and either end up in the groundwater if the landfill is not lined, or it can end up going to a wastewater treatment plant if that leachate is sent to a treatment plant. Another possible source are sludge or biosolids that contain PFAS. These are residuals left over from wastewater treatment plant that are sometimes applied to land. So now I will talk some more about what is known about the history of PFAS in the Hyannis drinking water system. And I wanted to start by commending the Hyannis water system in the town of Barnstable for all that they have done to address the problems of PFAS in the water supply. And right there is a picture of the Hyannis water system's superintendent, Hans Kaiser, standing in front of some of the activated carbon filters that have been installed by the water system to remove PFAS. Our researchers at Silent Spring Institute were the first to find PFAS in Hyannis drinking water back in 2010. No one had tested for them before, and we don't actually know when PFAS first got into the Hyannis water system. Our study was part of a broader study of emerging contaminants, such as pharmaceuticals and endocrine disrupting chemicals in public wells all across Cape Cod. For this testing, we had tested 3 of the 11 wells in Hyannis. The highest level of PFAS that we found in that time was about half of the EPA guideline level, which you may remember was set at 200 parts per trillion PFAS. As part of that study, we did not include testing of the wells that were closest to the fire training area because we weren't necessarily focusing on PFAS chemicals at that time. They were new and they weren't being extensively studied then. In late 2014, the Hyannis water system conducted more testing required by the EPA. This was through a program called the Unregulated Contaminant Monitoring Rule, or UCMR3. This testing included all of the wells in Hyannis and many of the other public water supplies on the Cape. And this testing found that the levels of PFAS in 3 Mary Dunn wells in Hyannis were above the EPA guideline at that time. The water system responded by taking those wells offline and installing activated carbon treatment. In 2016, as I mentioned, the EPA issued a stricter guideline of 70 parts per trillion for the total amount of PFAS and PFOA. The Hyannis water system, in response, issued a temporary do not drink advisory, which was in effect for a month and a half and provided bottled water. In that time, they worked out purchasing agreements with the Yarmouth and the Palm water supplies to add to the water supply in Hyannis to make sure that they were complying with the new guideline. In the years since then, the Hyannis water system has added additional carbon treatment system on their other wells in order to meet a series of stricter Massachusetts guidelines. And as I mentioned, in 2020, the Massachusetts Department of Environmental Protection passed a standard of 20 parts per trillion, which the Hyannis water system is now meeting. And I really wanted to emphasize this note that the Hyannis water system has installed treatment to remove PFAS and meet this new standard. So far, this has cost the water system over $20 million, and they're taking additional steps to continue to provide filtered water for the Hyannis water system. It's still important to study possible health effects associated with PFAS chemicals because we want to learn what we can from these past exposures before new standards and treatment were established. So now I'll talk about the multi-site health study. So this broad study is being funded and coordinated by the Centers for Disease Control and Prevention, or CDC, and by the Agency for Toxic Substances and Disease Registry, or ATSDR. There are 7 projects that have been funded as part of this multi-site health study in 7 states across the country in areas with a history of PFAS drinking water contamination. So Silent Spring Institute is leading 1 of 7 studies in Massachusetts. The other sites are located in California, Colorado, Michigan, New Jersey, New York, and Pennsylvania. So our study in Massachusetts is called the Massachusetts PFAS in Your Health Study. Our study includes 2 communities in eastern Massachusetts, Hyannis and the town of Air, west of Boston. The Air water supply has also been contaminated by PFAS from AFFF firefighting foams and possibly other sources as well. Silent Spring Institute is leading this effort together with researchers at the Harvard T.H. Chan School of Public Health and the Eastern Research Group, and our community partners, the Massachusetts Breast Cancer Coalition and People of Air Concerned About the Environment, or PACE. And later on, you'll get to meet some of our study partners. We aim to recruit 1,000 adults and 300 children for our study, combined across both of our communities. All of the other projects as well have this same recruitment goal. So across all 7 states, the broader goal is to recruit 7,000 adults and 2,100 children as part of the multi-site study. We expect that about 2/3 of our participants will come from Hyannis, so around 700 adults and 200 children. The other 300 adults and 100 children we plan to recruit in the town of Air. Participating in the study consists of several components. We'll ask participants to come to our office to collect samples of blood and urine, and also to do some routine body measurements. We'll administer a questionnaire to all participants. And for children participating in our study, we also have a series of neurobehavioral testing. Another component of our study is a reconstruction of past exposures. We will estimate the levels of PFAS in the Hyannis water system over time and use that to estimate cumulative lifetime exposures for each of the people participating in our study. This is a graphic that ATSDR prepared to show the steps of the study. We will be conducting extensive outreach in the Hyannis community, and tonight is our first major step in getting the word out in the community. We will be actively recruiting community members to take part in the study through mailings and community events. Over the summer and fall, we'll be conducting data collection where participants will make appointments and come to our study office. The samples that we collect will be analyzed by labs at the CDC, at commercial labs, and at academic laboratories. Once we get back all the test results, we'll prepare individual reports for each of our participants. I'll talk a little bit more about these in a minute, but we will be working with the team at Silent Spring Institute, led by Dr. Julie Brody, who created the Digital Exposure Report Back Interface, which is an innovative way to share results of exposures, results from exposure studies, such as this one. We'll also share community level results and publish scientific research findings. But I want you to know that we will never share, the individual results will be kept confidential, and we will never share anyone's name or contact information publicly. So who is eligible to participate in our study? Adults will be eligible if they lived in Hyannis between May of 2006 and July of 2016. So how did we pick those specific dates? We want to include people who may have been exposed to PFAS within the past 15 years. So that's why we're limiting participants to people who lived in Hyannis after May of 2006. And we're looking for people who may have been exposed when the water still was above the EPA lifetime health advisory of 70 parts per trillion. After July 2016, the Hyannis water system has been in compliance with the EPA lifetime health advisory. So that's how we develop those two time periods. Children ages 4 to 17 will also be eligible. They can be eligible if they lived in Hyannis between those two dates, or if their mothers lived in Hyannis during that same period of time prior to the child's birth. We know that PFAS can be passed along from mothers during pregnancy and through breastfeeding. Multiple members of the same household can participate if each of them meets our eligibility criteria. You don't actually have to live in Hyannis now in order to take part in the study, as long as you lived in Hyannis during that period of time between 2006 and 2016. People who are exposed to PFAS at work are not eligible for this study. For instance, firefighters and people who worked at industrial plants that used or manufactured PFAS. This is because an important part of the study is to estimate past exposures from drinking water. Children won't be eligible if their mothers worked in one of these jobs before they were born. So for this study, we are launching a new study office where we will have participants come for their appointments. Our study office is located at 171 Main Street in Hyannis, just east of downtown Hyannis on the south side of the street. I have a short video here just so you can see what our building looks like. So this is the front of the building at 171 Main Street, what you can see as you're driving down that road. And our office space is actually on the left side, or the east side of the building. So this is the part of the building where our study office is. And you can reach the parking lot, which is in the back of the building, from School Street or from this driveway on the left side of the building here. The entrance to the building is on the back side, so that's actually how you enter our study office from the back of the building. We have an extensive COVID-19 set of precautions that we have implemented in our study office to make sure that we're keeping our staff and all participants safe. We require masks in our office. We have hand sanitizers. We'll keep the windows open when we can and have air filters. And all of our study office staff members have been vaccinated for COVID. So what will we ask you to do if you're a participant in our study? We'll ask you to come to our office for an appointment. Before you come, we'll send you information about the study and consent materials. We'll ask you not to eat for 8 hours before your visit. That's because we're collecting a fasting blood sample. We'll also send you a urine cup so that you can collect a urine sample and bring it with you for your appointment. During your appointment, we will collect a blood sample and we will take in the sample of urine that you collected. We will ask you to list your current medications and our supplements. And we'll also collect some basic health information and some body measurements. So some of these are fairly routine, like height and weight and blood pressure. We've also added some different elements to our study beyond the requirements from ATSDR, including skin fold thickness, which is another way, just like BMI, to get at the level of fatness in people's bodies. We'll also set up a time to administer a questionnaire because of the pandemic and social distancing, and also just to make things more convenient for our participants, we'll be conducting the questionnaire by phone. We'll ask you about your health history and medical conditions. We'll ask you about where you've lived and worked over time. And we have some questions about your patterns of water consumption. For children ages 5 to 17, we'll ask them to return for a second appointment to complete a series of neurobehavioral tests. These involve things like playing memory games, sorting items into categories, solving puzzles, and reacting to photographs. So what are we measuring in people's blood samples? There are some core elements that are required by ATSDR and will be conducted on the blood samples from all participants across all 7 sites. All samples will be tested for 12 PFAS chemicals measured at the CDC lab, and they're exploring potentially adding additional PFAS chemicals to that list. They will also measure markers of health effects, such as different types of cholesterol, thyroid hormones, sex hormones, and markers of liver function. Each of the 7 sites has the ability to add extra components to our studies. So for the Massachusetts PFAS in Your Health study, some of our participants will have their blood samples measured in additional ways. So we'll do some additional measures of PFAS exposure. This will include non-targeted analysis, which will tell us about the presence of other PFAS chemicals not captured by the typical methods. We will also be measuring total organofluorine in some of the blood samples, which is a measure of the total amount of PFAS in blood. We'll also conduct some additional measures of health effects and trying to understand how PFAS are harmful to people's health. We'll be conducting metabolomics measurements through a laboratory at Emory University, which tells us more about the specific biological pathways that can be altered by PFAS. We'll be testing for additional cholesterol subfractions, and we hope to add testing for COVID antibody levels. So I wanted to pause and talk a bit about the possible connections between PFAS and COVID-19. So scientists and residents of exposed communities are concerned that PFAS exposures can worsen COVID-19. For instance, some studies have shown that children with higher PFAS levels may have higher rates of infectious disease and lower antibody levels in response to vaccinations. Now, I want to stress that there's no evidence that PFAS would make the COVID vaccine any less effective for anyone. But it's an important question to study whether PFAS levels do have any influence on COVID-19 antibody levels, because we want to make sure that the vaccine is protecting everyone's health. So we do plan to add testing for COVID-19 antibodies for our participants and for people who've had COVID to ask them about their symptoms. I also wanted to let you know that Silent Spring Institute is planning a separate study of PEEP residents who have tested positive for COVID-19. So stay tuned for more information about that new study. So what will participants receive for taking part in our study? For adults who complete all parts of the study, they will receive $50 in gift cards to thank them for their time and effort in taking part in the study. Children can receive up to $75 in gift cards if they complete all parts of the study, including the neurobehavioral testing. Again, there can be multiple people from a household who take part in the study, and each of these participants would be eligible for gift cards. In addition to the gift cards, participants will also receive a report with the results of their own tests. These will be generated using Silent Spring Institute's innovative digital online report system called Derby. We know that it can be concerning to find out that you, your family members, maybe your children have these toxic chemicals in your body. And through our research, we found effective ways of communicating this type of information. Even though we don't know a specific level of PFAS exposure above which certain diseases might be more likely, we can provide information to help interpret results. For instance, how do your levels compare to a typical American or to other people taking part in the study? We've also learned that people feel empowered when they receive information about things that they can do. For instance, how they can avoid additional PFAS exposures moving forward. We also offer print versions of our report too for participants who prefer that. And participants will receive the satisfaction of contributing to a major health study. We can't change past exposures, but we can learn from them and make sure that we're doing a better job of protecting future generations. If you're interested in taking part in our study, you can feel free to reach out to our study team at any time. I'll provide contact information in a couple of minutes. We are currently planning to launch recruitment in Hyannis in June. This will include mailing out postcards to all households that are served by the Hyannis water system. And we'll be finding other ways to reach out to the Hyannis community and let people know about the study. We aim to start scheduling our appointments for our field office starting in July. And our plan right now is to wrap up collecting data in Hyannis by the end of the year, depending on how much progress we're able to make. The pandemic has definitely slowed down the pace of this project. After we wrap up in Hyannis, we will transition our activities to the town of Air sometime early in 2022. Here's a sneak peek of a draft of the postcard that we're preparing to send out to Hyannis Water System customers this summer. So keep an eye out for this, and also be sure to tell your friends and neighbors about the study. So I really appreciate all of you coming tonight to learn about the study. Some of you may be here because you live in Hyannis and you want to find out if you're eligible, and others may just be here to learn. We'd like to ask all of your help in spreading the word in the community. Particularly during the pandemic, it's difficult to reach out to people without being able to meet with them in person. You can share information about the study, such as the link to our website. You can let our team know if there are any community events which would provide a good opportunity for us to meet with Hyannis residents. And if you're part of a church, school, civic association, or some other group, we'd be happy to come talk to your group. For now, we're doing everything by Zoom and looking forward to hopefully being able to spend time in person meeting new people later this year. We have interpreters on our team. They're with us tonight, and they're doing a great job in providing this information in Spanish and Portuguese. And for other events, we will work with these interpreters. So if that's a language need for your group, we can provide information in Spanish and Portuguese. We're grateful to our extensive network of community advisors for their support in our work. Our community advisory board includes town and county officials, medical professionals, family and early childhood service providers, and other community members. Our board is advising us as we develop our study and will be critical in providing feedback on our recruitment strategies and eventually how we share results from our study. They are also important ambassadors to the Cape community to help share information and spread the word throughout the community. I also wanted to let you know that Silent Spring Institute is recruiting for a separate study on PFAS called PFAS Reach. We're recruiting 60 preschool-age children in Hyannis to take part in a study specifically on how PFAS can affect immune systems in young children. We're looking for children whose mothers lived or worked in Hyannis before 2016. And we'd like to test children within a year of them receiving their final DTaP booster shot for diphtheria, tetanus, and pertussis. Some children may actually be eligible for both studies. We had initially planned to conduct our sample collection for PFAS Reach last year, but because of the pandemic, both studies are now conducting our activities at the same time. I know how hard it can be to bring a preschooler in for a blood draw, so we definitely wouldn't want children who are eligible for both studies to do more than one blood draw. And we're coordinating our efforts between the two teams so that children could come in for just one blood draw and still take part in both studies. And the slide has information about how you can email, call, or text our team to contact us if you're interested, and our website where you can learn more. So I'm going to wrap up the presentation component of our evening. I'd like to offer a huge thanks to the CDC and ATSDR for all their work to develop and implement the study. Thanks to our interpreters in Portuguese and Spanish tonight, Doris Vath and Idalie Harris. This is our first time offering real-time translation into Portuguese and Spanish, and it's really important to us that everyone in the community who's eligible can know about the study and feel supported in taking part. I also want to thank the town of Barnstable, especially Mark Els and Hans Kaiser and Dan Santos for all their work to address PFAS issues and for their support of our research, and to Sarah Beal for all her technical support in hosting this meeting tonight. Thanks to our community partner organizations for their amazing dedication, and to our community advisory board, and to all of you for attending. So here are links to our study website, as well as to the CDC ATR's website about the broader multi-site health study. If you're interested, you can give us a call, send us a text, or send us an email. We'll be happy to record your name and let you know when we're ready to start scheduling appointments a bit later in the summer. So At this point, I would like to introduce you to some of the other members of our research team. So the other leader of the project is Dr. Philippe Grandjean from the Harvard School of Public Health. He lives in Denmark, and so right now is a little bit too late in Denmark for him to be able to attend in person or via Zoom in real time. He wanted to send his best regards, and he prepared a short video for us to show as his way of saying hello.
Hello, I'm Philippe Grandjean. I'm a physician and adjunct professor of environmental health at Harvard University School of Public Health. I function as the joint principal investigator in this study, and I hope to contribute medical advice so that we can coordinate the different aspects of this study and provide the best possible advice to the Centers for Disease Control so that they can handle similar situations more efficiently in the future, and also to scientists, of course, so that we can move the knowledge forward, and also to you and to the communities across the country where the Centers for Disease Control know that there is PFAS contamination of the drinking water. I look forward to working with you, and I thank you for being part of this important study.
Okay, so in addition to Dr. Grandjean, our team consists of many different partners at Silent Spring Institute, Harvard University, Eastern Research Group, at the Massachusetts Breast Cancer Coalition, and people of AIR concerned about the environment. Cheryl Osimo introduced herself earlier. She's our main community partner on Cape Cod. I'm convinced she pretty much knows everyone on the Cape, and Massachusetts Breast Cancer Coalition and Cheryl specifically are key partners, not only in this study, but in our PFAS REACH study and in the STEEP Superfund research program. So now I'm going to stop sharing my screen, and we're going to do some brief introductions with some of the other members of our research team. So give me 1 second here. Okay, so I'm going to start out and ask Rebecca DeVries from Eastern Research Group to introduce herself.
Hi there, my name is Rebecca DeVries. I'm a senior epidemiologist with Eastern Research Group, or ERG. I've been with ERG for the past 5 years and have over 10 years of experience working on occupational and environmental health studies. Recently, I've been supporting several projects focused on PFAS exposures and health effects for different state and federal agencies. For this project, I'll be helping to plan and oversee recruitment and data collection efforts, as well as supporting data analyses.
Great, thank you for that, Rebecca. Now we'll hear from Neda Gavrelis of Eastern Research Group.
Hi, everyone. My name is Neda Gavrelis, and I'm a senior public health scientist, also with Eastern Research Group. And I have more than 30 years experience studying environmental health hazards, including recent work researching PFAS exposures across the country. And for this study, I'm helping the team plan and conduct data collection activities.
Thanks, Neda. Next, we'll hear from June Zhao.
Hi, everyone, and thanks for joining us. My name is June Zhao, and I'm the study coordinator for the Massachusetts PFAS in Your Health study. I've been coordinating large health studies for the past 3 years now, and I'm excited to be part of this one in Hyannis. Part of my graduate work has also looked at PFAS and health exposures, and I have my MPH, or Master's of Public Health, from Brown University. Once our study office is open, I welcome you to stop by. Thanks.
Thanks, June. Next, we'll hear from Ruth Ann Riddell, our Director of Research at Silent Spring Institute.
Hello, everybody. Welcome, and thanks for joining us. I'm the research director at Silent Spring. I'm a toxicologist, which means I study the health effects of chemical exposures. And I've been part of Silent Spring's research on Cape Cod since the 1990s, when we began investigating higher rates of breast cancer. on Cape Cod and trying to identify important environmental chemical exposures. In the early 2000s, Laurel and I working together, measured PFAS chemicals in some Cape Cod drinking water. And it took several years before this contamination was recognized as being widespread in the US and elsewhere. I'm really grateful to your participation. Your participation and support of this study is very important. What we learn here can help authorities know how these exposures affect health so that they can make better decisions about controlling exposures in the future. So thank you again for your interest and support.
Great. Thanks, Ruth Ann, for being here tonight. Next up, we'll hear from Maya Fitzstevens, also from Silent Spring.
Hi, everyone. My name is Maya Fitzstevens, and I've been a study coordinator at Silent Spring Institute for the past 2 years. My background is in soil science and water chemistry, and I coordinate the PFAS REACH study, which Laurel mentioned earlier, which is focused on the health effects of past PFAS exposures and is recruiting young families in Hyannis. You may have recently seen ads for this study in the Cape Cod Times, Barnstable, Patriot, or on Facebook. And for this study, I will be supporting community outreach and data collection.
Great, thanks, Maya. So Silent Spring Institute has been conducting research on the Cape since 1994 when we were started. And now we have a new partnership with our friends in the town of Air. We've just been working with them over the past 2 years through the course of developing this study. So I wanted to introduce you to Lori Nearing from the town of Air, who's the director of People of Air Concerned About the Environment. Thanks for being here.
Thank you, Laurel. Good evening, everyone. So I am the president of PACE, the local environmental advocacy group, which is People of Air Concerned About the Environment. Air, as you saw on the map, is in north central Massachusetts. It's about 15 miles west of Concord, Mass, right off of Route 2. Probably many of you know kind of that area. We are your sister community, and we also have the same problem you do. We have PFAS in our town drinking water, and we are delighted to be part of this study, which is so important. I serve as the community liaison and trying to support the grant and the needs of Silent Spring wherever I can. My main job will be connecting my community to the study and to help educate and outreach to my community. We are going to be learning from your successes and closely following what's going on in Hyannis, and we really look forward to supporting the study and supporting Hyannis in the future as well. Thank you.
Thanks, Lori, for being here. And yes, we'll learn a lot through our time in Hyannis. So by the time we transition to working in Air next year, we'll have figured out a thing or two. And now we have a few new people that we've recently added to our study team. Actually, yesterday was their first day of training in our field office in Hyannis. We have hired 3 new field study team members who will be the ones most directly working with participants as part of the study. So the first person that I'd like to introduce is Barbara Murphy.
Good evening, everyone. My name is Barbara Murphy, and I'm going to be part of the field team in Hyannis as a data collection specialist. I'm a nurse and bring with me over 30 years of nursing education experience and have my master's in nursing from Salem State University. And I look forward to joining the team and learning more about public health. Thank you.
Great. Thank you, Barbara. Welcome aboard. Next, we'll hear from Virginia Liu.
Hi, everyone. My name is Virginia Liu. I'm one of the research assistants working as part of the Hyannis field staff. I'm a resident of South Yarmouth and also a current Master of Public Health student studying epidemiology at UMass Amherst, and I'm really excited to be a part of this study.
Great. Thanks, Virginia. Welcome aboard. And our third member is Caitlin Smith. Caitlin, could you introduce yourself?
Hi, my name is Kate Smith, and I'm a research assistant on the Hyannis field staff. I'm local from West Yarmouth, and I recently graduated from the University of New England with a master's in public health.
Great. Thanks, Kate. And they can't introduce themselves because they're busy interpreting right now, but I'm really grateful for the time and effort of our two interpreters this evening, Doris Back, who's been interpreting in Portuguese, and she's actually been working with our PFAS REACH study over the past year to provide Portuguese and Spanish support for our participants, and Ida Harris, who's been doing Spanish interpretations. So with that, I think we will transition over to Q&A. I see that there are a couple of questions that have been entered into the Q&A, but you can, if you have any questions, you can add them in the Q&A's link at the bottom of your Zoom screen. So I guess I'll start with the first question here. Leslie asked whether PFAS are passed on through DNA to our children. So that's a great question. To my knowledge, PFAS aren't mutagenic. So that means, chemicals that can affect the sequence of our DNA. I'm not sure about any potential epigenetic effects. So these are changes that can occur to the DNA, not in terms of the sequence of the base pairs in the DNA structure, but how they get expressed. So that's a great question, and I think an area for active research. Our next question is about whether there are any age limitations within the time frame given. There's no age limits for children. They just need to be between ages 4 and 17, and for adults, 18 plus. Joan asked about what if she's someone who consumed bottled water during that time. And that's a great question as well. And another question that might have occurred to you is, why are we just studying Hyannis and or don't we need a control population to compare? I don't think that we need to have a control group. And the thought is that within people living in Hyannis or in air, there will be people who drank a lot of water, tap water all the time, and other people who maybe filtered their water or relied on bottled water. So among people who lived in Hyannis during that time, we'll have a range of exposures from the drinking water, and we'll be able to capture that information through our questionnaire. So even if you don't think that you drank a lot of tap water, we would still want you to take part in the study. I guess I would add too, when I think about tap water, I think about just drinking a glass of water. But if you think about coffee or tea or water that's used to prepare food, all of that contributes to our tap water exposure, whether it's direct or indirect. Jane asked a question about PFAS and drinking water in Mashpee. What are steps that you or the town of Mashpee are doing to address this? So the Mashpee public water supply in the short term had taken a well offline because it was falling above the EPA guideline, and they have been installing treatment that's been paid for by the Air Force to remove PFAS from the water. Susan asked a question, can you point people from the Upper Cape toward information about whether our drinking water is contaminated from the Joint Base? So that's, I guess, kind of a related question to that. Because of the new standard, water supplies in Massachusetts, if they haven't already started, will be conducting more extensive testing. So I just talked about Mashpee and the testing or the treatment that's going on there, and the Mashpee water system has certainly been doing testing. They were one of the other water supplies that were found to have PFAS in the testing from 2013 to 2015. So they've been addressing PFAS for a while. Falmouth is also has levels of PFAS that have fallen above the new Massachusetts standard, and they're also looking at installing treatment as well. If you'd like to find out, I don't know exactly where you're from, but if you're served by another water supply, you can find out information by reaching out to your water supply. The state also has a drinking water data portal where you can look up information. But for the most recent information, I'd recommend reaching out to your water supply. Leslie asked another question about cancer diagnoses excluding someone from the study. We don't have any eligibility criteria in terms of whether someone's a cancer patient or has any other disease, we would want to capture that information. For instance, if you're taking certain medications that might affect your immune system, and that might shape how we interpret results from immune system testing, but that wouldn't be a cause to be excluded from the study. I'll also mention that, that among the many health effects that are being considered by the ATSDR study, more broadly, cancer is not one of them. Even though it's a fairly large study by including almost 10,000 people, it's still somewhat of a small study from the perspective of cancer. But I know that ATSDR and CDC are looking for ways that the study can be used to address cancer. One of the great things about doing a community meeting by Zoom is that people can tune in from different places. So we have a question from Sarah in Pennsylvania. I've been trying to set up a program where I live. I'm getting nowhere. Could I apply for training in Hyannis, or do you know of a similar program in the Philadelphia area? I would mention that, that one of the other multi-site studies is being conducted in Bucks County in Pennsylvania. That work is being led by RTI and other researchers. So if you look on the CDC website, you could learn about the work that's being done as part of the multi-site study in Pennsylvania. So I hope that answers your question. Susan followed up about that she lives in Bourne. I don't know off the top of my head about any water test results in Bourne, but I can follow up with you if you'd like to send me an email. Barbara Moran asked a question, can you explain a little bit more about the information about drinking water habits that you want to collect? How can people remember how much water they drank? Well, that's a good question. And it's certainly not something that people can necessarily remember very accurately. The types of questions that we ask include how many cups of water people typically drink during a typical day. We ask them to try to go back in time and answer that question for different places where they've lived over time. We ask about any water filtration that they had at each of the places where they've lived. And we also ask about whether people drank mostly bottled water, mostly tap water, or some mix of the two. So it's not a perfect measure or necessarily very accurate, but other studies have been able to see differences between people who report more or less water and the levels of PFAS in their bodies. Carolyn asked a question about calm water customers as well. So this is Centerville, Osterville, and Marston's Mills. And I don't have the calm numbers off the top of my head. I would, for this question and also for the question about Bourne, a couple of months ago, the STEEP Superfund Research Program conducted a webinar about PFAS in public water supplies on Cape Cod. And we provided information about how you can look up and learn about PFAS levels in your water supply. So I don't want to speak inaccurately. I don't have the information off the top of my head, but I'd recommend you reach out to the water supply to find out about PFAS testing that's been done there. And again, I can, you reach out to me by email, I can look that up. Just don't have that in my mind right now. Okay. Another question from Joan. So can PFAS infiltrate vegetables grown using Hyannis water during the time the water was not treated? That's a great question, and something that hasn't really been studied much yet. There have been some studies to look at the ability of PFAS to be absorbed by plants from the soil. And from what we know, chemicals like PFAS and PFOA, what we call more of the long chain PFAS, aren't necessarily taken up by plants very readily. It tends to be the newer PFAS chemicals that are now being used in products that might be more likely to be absorbed into plants and end up in the shoots or the leaves that that people might consume. It's a good question, and it's been something that we've been thinking about as well in in soils that were irrigated for many years with the Hyannis water, whether there might be elevated PFAS. So stay tuned. It's something that we will be also considering in the coming years. So unless anyone has any other questions, I think that I will hand this back over to Cheryl.
Thank you very much, Dr. Shader. On behalf of the Massachusetts PFAS and your health study team, I'd like to thank you again for joining us this evening. Thank you to Dr. Shader for your informative presentation and taking the time to address everyone's questions. And we are deeply appreciative to Mark Ells and the town of Barnstable for their support of this program. I would also like to extend a special thank you to Dr. Julia Brody, Executive Director of Silent Spring Institute, for her leadership. A recording of this webinar will be made available on the Town of Barnstable's website and also Silent Spring Institute's YouTube pages. This study will support not only Cape Cod and Air, but also affected communities nationwide by sharing information and offering solutions so that communities can better protect themselves. A quote from Margaret Mead: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." Thank you, everyone, and have a wonderful evening.